Angioplasty is a medical procedure used to treat narrowed or blocked blood vessels, usually arteries, by widening the narrowed area. This procedure is commonly performed in coronary arteries to address conditions like coronary artery disease. Here's a step-by-step breakdown of how an angioplasty is typically carried out. Preparation. The patient is positioned on an X-ray table in a specialized operating room. Catheterization lab. Electrodes are attached to the patient's chest to monitor heart activity, ECG. The area where the catheter will be inserted, typically the groin or wrist, is cleaned and sterilized. Anesthesia. A local anesthetic is administered to numb the area where the catheter will be inserted, reducing discomfort. Insertion of catheter. A small incision is made at the insertion site, usually the femoral artery in the groin or the radial artery in the wrist. A thin, flexible tube called a catheter is inserted into the artery. It is threaded through the blood vessels while guided by X-ray imaging. Guidewire placement. A guidewire is advanced through the catheter to the site of the narrowed artery. This helps the catheter reach the precise location of the blockage. Angiography. A contrast dye is injected through the catheter into the arteries. X-ray imaging. Angiography is used to visualize the blood vessels, including the location and severity of the blockage. Balloon catheter insertion. A balloon-tipped catheter is threaded over the guidewire to the location of the blockage. The balloon is positioned within the narrowed segment of the artery. Balloon inflation. The balloon is inflated, which compresses the plaque or fatty deposits against the artery walls. The inflation widens the artery, restoring blood flow. Stent placement, if necessary. In some cases, a stent is used to provide structural support and prevent the artery from re-narrowing. The stent may be mounted on the balloon catheter, or delivered separately and then expanded using the balloon. Balloon deflation and catheter removal. Once the artery is widened or a stent is placed, the balloon is deflated and the catheter